Dr. Gautier, what do you like most about your country?
That's an interesting question. You know, it's sometimes emotional for somebody talking about one's country. Maybe I can share with you that the first time I was a long time away, and when the plane landed, I mean, tears came to my eyes because I was really having a wonderful time abroad. But when I landed, I feel this is it. This is where I belong to. This is where my roots are. So I love everything about the country. If I have to talk, I like the nature. I like our history, how we came about. I like how we struggle, how we keep fighting. I like the beaches, Caribbean water. I mean, everybody knows there is not like that.
And is there the food, for example, the specific Haiti food?
Also. Well, you can be open to all kind of cuisine. Yeah, it's not my first, but true.
How was it like to grow up in Haiti?
Back then, I'm in my
It was
60s.
it was a politically dark time.
It was difficult under Duvalier, but there was a relative stability, I would say. If you are not directly implicated in politics, life seems normal because it was his moments, maybe some people know about that, were protected by his powerful friends from the US because it's an era where there was still communism. So he was a good ally for the US. Therefore, they left him do what he was doing, even it was very difficult for the people. So I had a very normal childhood. I grew up in a small town, really not too far from the capital, going to school, playing soccer with my brothers, and enjoying life. And of course, going to school.
You studied shortly in the US. Did it ever cross your mind to stay there?
I had a year fellowship at a wonderful referral hospital at Duke Regional Hospital in North Carolina, well known in general and in medicine in particular. But I was already a pediatrician. And before that, I did take what they call a certificate. I did pass an exam that would allow me to go and continue as many other colleagues in the US. But at that time, I really didn't see it like that. I would not be honest if I don't say it has never crossed my mind to leave, but it was on one specific occasion where the country was under an embargo and life was miserable. Children could not go to school. The liter of gasoline was like 10 times the cost. And then it was really hard. It did cross my mind because many of the students then were immigrating. But really, for one Dr. Gautier in Haiti that can make a difference, who can make a difference, there are several in the US. So I think that I rather stick to Haiti.
That is the reason what you made go back to Haiti?
Actually, currently, I am considering a transition toward retirement in a few years. So, and my children are living abroad, I may travel as a retired person and helping my organization in other capacities. But I don't see myself working at another venue, at another country than Haiti, and then healthcare and children causes and women causes healthcare in Haiti. That's why I devoted my life to, and I want to continue as long as I'm able to.
What is it like as a female professional to work in Haiti right now?
It's an interesting question. I always thought, because while I study, we were at almost 50% female and 50% men in our class, I never thought there was any kind of difference. But of course, as you grow and looking back and having to take care of your family and having to do certain other things and having to take some precaution, it's a bit more difficult. Therefore, women work harder to be career women. So that's the difference. But in our society, there is no discrimination about, this doctor I prefer because he's a man.
What are your hopes and your dreams for the future of Haiti?
We need definitely to get out of the red in our vital statistics, in our economy, in the chances for families and children to live a decent life. So this is my dream, that we would continue to work so we get more decent conditions for the majority of the population. And it's not simple.
What are Haiti's biggest struggles?
Haiti's socioeconomic situation is a disaster. Most people are living in poverty. Therefore, we need good governance in order to address that properly. Employment, healthcare, education, structural work, so we are less vulnerable to disasters. Disasters are there to happen everywhere in the world, even in the Netherlands. But the structure have to resist. We cannot control disasters, but we can certainly control where people live, how they live, and how they eat, how the children are raised. So we need a very strong program to address all those problems that are inequalities.
And what do you need to accomplish this?
We need everything. But it's not to say that we would start in a vacuum, though. There are certain things being done. We just need, well, I hate when people say it makes it too easy. So we need a more coordinated effort and bigger efforts. It's not to say there is nothing being done. I want to think my hospital is making a difference, for instance, in healthcare. But we need more of productive programs on all domains. So there is a critical mass created, so it makes an impact.
Can NGOs play a role in this process?
I think for now, yes. But, anything that should have a lasting impact, good impact enough to make a difference, will have to go through the government. You will understand that. We cannot ask NGO to address potable water to the whole country. They can do it on a specific area. Otherwise, they're not built to replace government. So there always comes some kind of thing, okay, it's only the government, but the government maybe is weak, so we need NGO. So at some point, it will be the government. But while the government should work to get stronger, the NGO have their place, I would say. But it also depends on which NGO. NGO that have strong ties with local are certainly more efficient than an NGO that is really just come on a disaster time, and because they're big and they're powerful and they can raise tons of money, and so
Don't know the local situation.
many times before, I would not say that they don't do anything, but lasting progress cannot depend on external. And it's by your nature of things.
And what do you think about help from foreign governments or big companies?
I think the world is one now. I think there should be some solidarity, not only by strategy, but also historically. When you think about what Haiti represents to the whole world, it's a country that has served the colonialism. So many France and other countries benefited. And it's also a country that was the first Black republic. Well, and that also brought freedom, the real sense of freedom to the world. A lot of time we are known for bad things, but people have to remember that the real freedom, Haiti brought it to the world. Because when we became free back in 1804, we were free and we were exporting the idea of freedom to other countries. Other countries had very nice slogan about freedom while they were still having slaves. So real freedom, we taught it to the world. So in return, we need some kind of solidarity, because freedom is we would say it's the essence of things. It's the essence of things. We all strive to be free, and freedom is just not enough. We need also to have human rights respected in a broader sense of things. Access to education is human right. Access to healthcare is human right. Access to justice is human right. We're just not limited to justice or freedom, but also to well-being.
10 years ago, you had a lot of help from all over the world, but that didn't work very well. What went wrong?
Well, there have been a lot of documentaries about that. First of all, the whole publicity about the level of the help is not really what got to the country. We spoke about international or big NGOs. There have been a lot of documentaries by which it was evident that explain well that most of those resources stay where they came from. No. Paying for huge salaries of experts, paying for rent, paying for cars, paying for administrative huge costs. And from the part that reached the country, there was corruption, local and external. I don't know if you can talk about the efficiency as corruption, but if you have a huge overhead and only a small part of the money, you can question that. So first of all the money did not reach us, and there was not necessarily a good understanding of the best way to help. So hopefully people learn some lessons, because there are a lot of debates and discussions. And currently we're facing a disaster at a less magnitude than the other one, and hopefully the rescue will be done in a different way.
How can we work together? What do we have to change from our part?
Because of that history that we just spoke about, we need to think that Haiti is a long-term partnership. Whatever partnership ready, we need first commitment, and we need long-term commitment, whether it is financial resource or technical resource. It has to be a long-term work. And also some meaningful work, really being meaningful partnership with locals.
Would a stable political environment help?
This is really crucial.
And why is that so difficult to create in Haiti?
There are historical reasons, as we said, historical reasons, and also there are also work that need, as I just said, long-term commitment and not technical short fix. Technical short fix, whether it's on a personal basis or on a national basis, they don't work. You need to go deeper to understand the root causes of things. Then you can address it. You can address them properly.
Mm-hmm. But what does the country need to get a stable political environment? Do you need new young leaders?
I think young leaders everywhere is a good thing. You would agree with me? I think we cannot do, and there have been a lot of debate about those new vaccines, about COVID, where people want that we make vaccines the same way we were doing them at Pasteur's time. So if you really stick to just people who've been always there, it doesn't work. You need new ideas, you need innovation, and you need to think in a way that you can, if something doesn't work, you cannot continue to do the same thing with the same people. It's by principle. You need to bring new ideas, and young people can bring new ideas. We see a lot of, in the world, a lot of new things are done by young people.
Do you see a change with the political environment, the people who work in politics in Haiti, that they are open for this change?
There are a lot of debates, I would say, but first come ideas. And there are a few initiatives, but we need more of them that are hopeful and that give hope, whether it's on the cultural domain, whether it's on the education, thinking about different schools to help children learn a different way, whether it's on economy, to really address with microcredit small pockets of people that were not reachable usually by the usual credit initiatives. There are some answers. I'm in the medical field. I'm a hospital administrator, so of course I don't have the answers for everything. However, you hear a lot of interesting discussion. We used to joke, but in the term bad humor, to say Haiti is already developing drawers in plans. We need to have courageous leaders, innovation, determination in order to reverse the tide.
Is there anything that can be done to lower the impact of emergencies like the earthquakes or tornadoes?
As I said earlier, they are there to stay. We're the country is on a fault, then there will be earthquake. We need, just as other countries have shown, Japan, Chile, to build differently, and to be able to sustain the impact of storms or earthquakes.
If you could change one thing, what would be the first thing you would like to change?
Changing one thing and hoping that things will change will not work. It should stay on a multifactorial aspect, because we don't have any magical one.
What would you say to donors who are thinking about supporting Haiti?
I would tell them to stay committed and to inform themselves well, to avoid the traps of fatigue or thinking that we're cursed, because it's doable. The changes are doable, And frankly, in a current world where technology is there, or there are ways to address, Haiti can benefit from their support, pending that it's not just a fixed support. I'm giving this, let me see that tomorrow.
Now about your work. How is the general situation of the public health care in Haiti?
We have a number of challenges in terms of children mortality, even women giving birth mortality, and pure access to healthcare. But before healthcare per se, there are a lot of other determinants of health, like access to potable water, access to nutrition, access to less pollution, promiscuity. So we need strong public health programs to address that. Also be able to control the population, the demography, so there is less pressure on the services. So first, as we say in French, en amont, before health, we need to address those health determinants. And also we need to address the quality of healthcare on the institutions.
What is the biggest health concern in Haiti? You mentioned a lot already, but what is the biggest?
It's a complete program. It's a complete program, and one has to really address. It's hard to think you have to solve everything, but you need certainly to start. And there are good, even locally, there are a few success stories where children are well vaccinated, so you can prevent certain diseases cheaply, where there are strong public health programs, and where also there are healthcare providers ready to care for sick people.
What kind of structural help is needed regarding the healthcare system?
The structure is really keeping the access.
Mm-hmm. But is the structural help that you need is money, or is it?
Of course, all of what I've said need. We have a French saying, money is the nerve of the war, when people were just doing war. So you don't go to war without money. You cannot do any strong program without resources. Whether it's always get to money, but it can be equipment, it can be education, and of course, medication, material. Those are expensive. And in a country where you don't have universal access, meaning health insurance for all, it's a challenge, because a lot of it is paid out of the pocket and money is not really available. So we certainly need a larger program of access, universal access to care, and then good institution, well equipped, with the proper staff, whether it's administrative or directly healthcare providers. So of course, all of this needs.
What is the current situation at St. Damien?
St. Damien has progressed a lot over the years. We've been in existence for 30 years now. And we progressively position the hospital as a referral hospital. And so on the network of work, we're in a good position, but that we need a constant work to strengthen that, and to study the environment, and to understand the challenges. And it's the right moment for us now, because we're studying our next strategic plan. So we can address what we need to address in order to keep our position for the families coming to us, and also develop the hospital so it remains a beacon of hope in health.
What do you need most at the moment?
At the moment, we're in an environment that is not favorable. It's larger than the hospital in terms of your referring to political stability. We need some kind of stability in the country because nothing can function well without some stability, so the workers can really work or drive to work with no sense of insecurity first. And then there we need more financial resources to be able to compensate the workers well and to be able to always keep our stock. So we do need financial resources.
What did you already accomplish at the hospital that you are proud of?
It's a work of a team, of course, that I am leading, but we can be proud of the ward. No, we can, looking back, see how the hospital has not only been doing more over the years, but doing better work over the years. So this is definitely something that the whole team should be proud of.
And how can donors particularly help the hospital?
Informing themselves and taking and accept to trust our work, and informing themselves will help them understand what we do and what remains to be done to continue. And remember, and it's a long-term work.
So they need to give money each year.
Yes, and we also receive in-kind support in terms of equipment or technical support, whether it's to have an electronic system to go more paperless, whether it is to maintain our equipment, whether it is to discuss cases with medical partners over the world. So it's on all aspects, but money definitely will be good.
What do you want to say?
I'd like to tell everybody who has already contributed to our work, I'd like to say thank you to each and every one. It's been wonderful. You have contributed to something valuable. And I'd like to encourage you to continue, because we will continue to make interesting plans in order to cover healthcare for every child coming to our world, every woman needing healthcare. Thank you. So since June this year, we have gathered in the different part of the hospital. We have done some workshop thinking about what are the next steps we need in order to continue our work or improve some part of it, whether it is some structural renovation work or more compassion toward the families that we serve. And we have very interesting ideas on how best to do it in the next 5 years. So it will take some commitment to implement all these plans, trying to continue our work for the benefit of the healthcare of vulnerable children and vulnerable women.
In spite of the situation in Haiti?
In spite and because you certainly need to be ready to address the challenges as they come. The challenges are one thing, but the preparedness and also the persistence is important. in this. The persistence of us on the ground and of everybody as supporters. We are known as courageous people, but that's not to say that at times we don't face discouragement. But I think the drive to keep the hope is more. It might be historical, but it's ingrained that we have to face it and continue. That's why people need to be informed, because the news like sensationalism. Good news not make news.
Do you think that the Haitian people can come out of all the disasters that overcome them again and again?
The negative impact is big, to be honest. It's big, and then more. That's why it will take really bigger efforts, probably much bigger than the short and small technical fix. To quote an organization that sometimes help us as leaders to be aware of things, technical short fixes are never the answer. So it's doable. It's not desperate. Pending that we measure the effort and put the effort on the level of the challenges. Nowadays, things should not be impossible. Developing Haiti should not be impossible. There is hope, and there are certainly savoir-faire at the current level of development in the world, thinking about the world as one. It should be possible. That's my belief. There is certainly more to Haiti than disasters. We have a vibrant culture. You should know that literature is really active. There are a lot of books written by women and men that get international prizes, in French mostly because we speak French, and also the art craft, and also the music, and also institutions like ours. We are making the difference, whether it's strikes from other institutions, whether it is political problems, keeping people going. We organize to get our workers to ambulances, and we want to continue so that our work is not just something that is done when it's possible, but that is always be accessible. And that's how healthcare is. I'm sure that in the Netherlands, you would not think that, okay, these days are not good, let me not go to the hospital. So St. Damien is an institution that is committed to its mission. Keep the work accessible and of quality to people. And it's not simple, because at times it's a huge challenge, but we're a success story.